Okay, let's jump right into this explainer. Today, we're going to demystify the honestly overwhelming landscape of modern contraception and look at how safety is actually determined. Because the truth is, choosing contraception, it is definitely not a simple one-size-fits-all situation. We're talking about over a dozen methods out there, and they all work differently. They've got varying effectiveness rates, distinct risks, and, believe it or not, some pretty unexpected extra health benefits. So we're going to break all this down to help you understand the exact frameworks healthcare pros use to help you make a truly informed, empowered choice. To help us navigate through all of this, we're going to hit 5 key areas. Starting off with the menu of methods, comparing your options, diving into UChem, which is the safety framework, weighing those risks and benefits, and finishing up with a much-needed STI reality check. All right, Section 1, the menu of methods. Let's take a look at the most common daily choices available on the NHS and see how they differ. So right off the bat, let's contrast the combined hormonal options with the progesterone-only pill. The combined hormonal contraception, or CHC, this includes the pill, the patch, and the vaginal ring, contains both estrogen and progestogen. Basically, it works primarily by stopping ovulation altogether. It's super effective, but here's the catch. That effectiveness drops in the real world because you actually have to remember to take it every day or change the patch weekly. On the flip side, we have the progesterone-only pill, or POP. This is a daily pill with absolutely zero estrogen, which is huge because it means it can be safely used by a much wider group of people. It mainly works by thickening cervical mucus to block sperm, though newer formulas can stop ovulation too.
Now, if you're someone who struggles to remember a daily pill, and let's be honest, that's a lot of us, long-acting reversible contraceptives, or LARCs, are a total game changer. Once they're in, you just go about your life. First, there's the implant, a tiny rod placed under the skin of your arm that gives you 3 years of highly effective protection. Then we've got the injection, or DMPA, which just needs to top up every 12 to 13 weeks. Looking at options inside the womb, there's the hormonal IUS, like the Mirena coil. This lasts 5 to 8 years and often has the incredible bonus of shrinking your periods down to almost nothing. Finally, if you want zero hormones, there's the copper IUD. It lasts anywhere from 5 to 10 years, though just a heads up, it can sometimes make your periods heavier and a bit more crampy.
Rounding out the menu, we have our physical barrier methods. Think external and internal condoms, diaphragms, and caps. They do have a lower effectiveness rate with typical use compared to LARCs, but they play a uniquely vital role that we're going to circle back to shortly. And finally, for anyone who is 100% certain their family planning days are over, there are permanent sterilization options like tubal occlusion or a vasectomy. Actually, fun fact, a vasectomy has a lower complication rate and is usually the preferred first stop for couples looking into permanent methods. Okay, moving to Section 2, comparing your contraceptive options. We really need to figure out how these stack up against each other in terms of effectiveness and risks. So when we look at these side by side, the effectiveness numbers tell quite a story. With methods that rely on you doing something, like taking a pill or putting on a patch, typical effectiveness sits around 91%. But when you look at the LARCs, like the implant or the IUDs, boom, you're suddenly over 99% effective. Why? Because human error is completely taken out of the equation. Condoms sit a bit lower, around 82 to 87% for typical use. But what's really crucial here is that key risk or consideration column. We're talking blood clot risks, bone mineral density loss, irregular bleeding. So how does your doctor decide if a specific risk is a deal breaker for you?
That perfectly tees up Section 3, UKMEC, the safety framework. Let's see how medical professionals actually make those safety calls.
Enter UKMEC, which stands for the UK Medical Eligibility Criteria. This is basically the ultimate safety filter. It isn't just a list of vague suggestions, it is a rigorous, science-backed framework. It guarantees that the contraception you're getting prescribed has been cross-checked against your specific, unique medical history. It works by stepping down through 4 simple grades. Grade 1, totally green light, no restrictions. Grade 2 means the advantages generally outweigh the risks, so it's still a good option. Now, Grade 3 means we have to pause. The theoretical or proven risks usually outweigh the advantages, so you'll need some specialist judgment there. And Grade 4 is a hard stop. Unacceptable health risk, do not use. For example, if you get migraines with aura, or if you're a smoker aged 35 or older, combined hormonal contraception is an automatic Grade 4. No questions asked.
Section 4. Weighing risks and benefits. Beyond those strict UK MEC rules, let's explore the nuanced risks and, honestly, the surprising health benefits.
Let's start by addressing the stuff that often sounds pretty scary. VTE, which is deep vein thrombosis and pulmonary embolisms, and breast cancer.
Yes, using combined hormonal contraception does increase your VTE risk compared to not using it, but the absolute risk is actually really small, unless you add in factors like a BMI over 30, smoking, or a family history of clots. As for breast cancer, data shows a very small absolute risk increase during current or recent use of both hormonal methods. But again, this risk remains small for individuals and seems to drop off once you stop using the method.
Now, keep the numbers 18 and 45 in your head for a second. The DMPA injection is a bit unique because it can actually cause a drop in your bone mineral density while you're using it. Don't panic, this usually recovers after you stop. However, doctors are super cautious about giving this to anyone under 18 or over 45. Think about it. Teenagers are still actively building their peak bone mass, and women approaching 45 are naturally getting closer to a menopausal decline in bone density. For them, long-term use shouldn't just be the default. It requires a really careful chat about the pros and cons.
But here's where things get really interesting. Hormonal methods actually offer some incredible, scientifically recognized protective benefits. It is not all just about preventing pregnancy. The combined stuff, it's associated with a reduced risk of colorectal cancer. Even more amazing, it's linked to a lower risk of ovarian and endometrial cancers. And get this, that protection persists for years after you stop taking it. The injection also chips in by reducing the risk for endometrial cancer. And if you're someone who deals with awful, heavy bleeding every month, a hormonal IUS can be an absolute lifesaver. In fact, doctors often prescribe it purely as a therapeutic treatment for heavy periods.
And finally, Section 5, the STI reality check. We need to clear up a massive and frankly dangerous misconception.
So, with all these amazing methods keeping you safe from an unplanned pregnancy, you have to ask yourself, do they keep you safe from sexually transmitted infections?
The answer is a resounding, absolute no. The pill, the patch, the implant, the IUD, sterilization, none of them offer even a single ounce of protection against STIs. All those cancer-protecting benefits and 99% pregnancy prevention stats, totally irrelevant when it comes to STIs. External and internal condoms are the only methods that reduce STI transmission, and even they aren't 100% foolproof.
So, if you're on the pill or have a coil and you start seeing a new partner, you absolutely still need to think about STIs. Contraception and STI testing are two entirely different conversations. But the great news is, taking charge of this is easier than ever. Your local GUM clinic, that's Genital Urinary Medicine, offers totally free, entirely confidential testing and treatment. You can just self-refer. And if you'd rather do it from the comfort of your own couch, a lot of these services offer online postal testing kits that just show up in your mail.
At the end of the day, there is no magic, perfect method for everyone. It completely comes down to your personal health history, your lifestyle, and exactly how those UKMEC safety grades apply to you as an individual. So knowing all this, from the hidden risks to the surprising health benefits, are you currently using a method that actually works for your body, or is it time to rethink your strategy? Thanks for checking out this explainer, and stay curious.